Howdy folks, Brian Kusko here at Triple B, coming back to another Herpeton talk. This is part 2 of Scott Stahl's talk on reptile reproduction. If you missed the last video, you should go back and watch that one first because it was part 1. This is part 2. He's going to be talking about how to identify whether or not your reptile is gravid, and he's going to show lots of really cool reproductive pictures and different instances of dystocia, and there's a lot to learn, and there's lots of great video and visual aids that Scott brought to break this thing. It's a great presentation. Just wait here, watch it.
All right, let's move on. So we talked a lot about sexing, so let's get into some fun stuff. Let's talk about like how we can determine pregnancy in our reptiles these days. Well, we've got this. Here's our morning gecko with the cloud. You can see the eggs in there fairly readily. And then, you know, with chelonians, I know a lot of you are probably quite skilled. You can put your fingers in, you can feel those eggs bouncing back and forth in there quite well. And then snakes, people get quite skilled at palpating ova here, or sometimes they've got these big monster eggs in there and you can see them without even picking them up. This was an animal that was in a dystocia situation. Obviously, his eggs are quite big. And then we can use radiology to do that as well. So we have here's a green iguana where you see these arrows, you can actually see the calcified eggs, all right? So you can, and again, most lizards don't have a whole lot of mineralization to their ova, so sometimes you can't see that calcification quite obviously like we do in birds. It's very obvious. And then over here, you've got the opposite. There's our chelonian where, you know, x-rays are probably the most effective way to look for eggs in them. We can take a quick shot, and we only need the one view, and then we can kind of see what the numbers look like and make sure that these guys look like maybe they're kind of stacked up on each other, but these eggs are probably okay, and she's probably going to lay those okay. And then here's a snake, again, not as much mineralization, but you can kind of see that increased density of the two eggs here side by side. And then this is an Amazon basin tree boa, and you can see these boas all nicely coiled up in here. So when they're that far along, you can certainly see the fetuses in there as well. And this is how they should be, is kind of as a tight coil. Okay, and then ultrasound. Ultrasound, again, another effective way. We can actually do more than just look at the eggs. We can try to look at maybe some staging of where the development is and where we are. Sometimes we'll use a water bath to do it, to get, you know, reptiles, their skin being keratinized. We don't get as good of an acoustic coupling, if you will. So we use a lot of gel, or we use water. Whatever you do, don't make sure that the probe is water protected, because you could ruin a $15,000 probe by sticking it in the water, because Dr. Stahl said it was a good idea. So don't blame that on me. Make sure that your probe is protected. And then here's Dr. Divers doing an ultrasound on a green iguana here. And what kinds of things do we see on ultrasound? Well, again, this is a chelonian where we can see, again, a definitive anechoic. Remember, or the anechoic is the black in here, and the increased echogenicity of the shell here. This is a leopard gecko. Obviously, this is a cross section of an egg, so we're going through the animal from top to bottom instead of laterally, and you can definitely see the shell and a little bit of the yolk material inside. And then over here we have a snake with, again, it's probably fairly far along. This is an oviducal egg with minerals, and then again we have a boa here, and the heart would be beating, which is quite nice as well. And then you can see the spine. These guys also kind of circle around when you're watching them. They'll spin like this back and forth, okay, which is very cool to see. And then this is one of my girls, thanks to Philippe, who gave me a male many years ago. I've been able to produce the lesser-snouted New Caledonian gecko, Trachycephalus. And so here's a video of her. We were doing a pregnancy check on her, which I hope I can get this to where we'll be able to go. Here we go. You can see the heart beating there. I'll try to keep playing it here. So those are the little heartbeats. So she produced 2 babies, and you can see the heartbeat of the one is here, and then one is right behind it. This is the yolk material around the live baby, and then there's the spine, and then again when I hit my little, you can see. So the red and the blue is the blood going away from the ultrasound probe and into the probe. It doesn't necessarily mean that it's oxygenated or not oxygenated, but it's very cool to be able to put an ultrasound probe on one of these live-bearing species that you're kind of clueless, really. It's very difficult to tell sometimes what's going on with them, and to see that there's those little babies in there. And then again, now my colleague who was one of my associates who insisted I buy the CT scan, this is one of the reasons that he insisted we had to have it so he could make me cool things like this. So this is a Bronia campbelli that was gravid that came in that we did a CT scan on. Look at the great things you can do for $250,000. Thanks. Okay, anyway. So I'm glad he's enjoying it. So these are the little, you can see there were 12 babies inside this girl. And you can sort of, if you kind of watch, you'll see these little V shapes of their skulls. And so she was just jam-packed. So after that, again, we were a little nervous, but remember what I told you about the CT scan. Even though it takes all those images, it actually is a very low radiation comparatively with these newer CTs. It literally plugs into the wall. And so it's quite compatible to small animal practices. Anyway, she gave birth about a week after we did the CT scan, and all the babies did well. So pretty cool stuff. Again, maybe a little pricey for a CT. You know, you probably don't need to do that to determine pregnancy, but it's available to us. All right, so now let's talk about, we're talking about just sort of what we hope to be healthy pregnancies or gravid animals. And so what about when we're having trouble? One of the things that's difficult with reptiles is actually trying to figure out whether an animal's having a normal pregnancy or a gravidity or whether it's actually having a problem. And that's quite a challenge. It's a challenge that I really like, but not everybody's up for it, but I think it's kind of exciting. Each one of these animals that presents, it's sort of like a mystery, and you have to try to figure it out. And so anyway, so here's some of the things that we look at. And again, you guys are experts. We don't have to spend a lot of time on that. You know, maybe they've laid a partial clutch, and these are what the eggs look like, and they don't look good. We already talked. Or they're looking like this and getting lethargic and depressed. Or maybe they're rooting around, and you can feel something obvious going on in the coelom, and we know there's an issue. Or a lot of times there may be some behavioral things, or even something like prolapsing. Those are the things that might give us a clue that we need to look a little harder to see if we're having an issue. So let's just go over a quick list of like what are the causes, the general causes of dystocia in reptiles. The first thing I'll say is it's like with a lot of things we've been talking about in the last couple of days, it's complex and multifactorial. A lot of things going on, and again, a lot of them are probably related to husbandry. Just like we've talked about, we're all trying to simulate what's going on in the wild, and the sooner we get closer to that, the more likely, these guys are going to, give birth or lay their eggs or which is why we're all here, so we can learn how to do that, and something as cool as the earless monitor, right? So that's just awesome. Anyway, so inappropriate nesting sites, there can be captive stress. Maybe they don't like hanging out with their mate once they're gravid. Obesity is a big one. A lot of these, and I think that's one of the big issues that we deal with like green tree pythons and a lot of our Amazon tree boas, is we're overfeeding these guys. Some of the research that has come out from David Wilson, who's done a lot of his field work there, showing that these animals that we're working with in captivity are huge compared to the animals he's finding in the wild. And so when we feed these things like crazy, thinking we're going to increase our fecundity and get better production, they end up with a dystocia problem. They can't give birth, they can't lay their eggs, they're inactive, they're not moving around. So all these things probably play into it. And this slider here decided this is where she wanted to dig her little nest and lay her eggs, but in captivity, a lot of my clients don't even know that these females will and can lay eggs even without a mate, so they haven't even provided a nesting site. So a lot of these red-eared sliders that I see, they come in and they've got eggs and the owner didn't even know, one, that they were a female, and two, that they had eggs. So we've got to do a better job of providing the proper nesting areas. Other things, of course, there's dehydration issues there. Salpingitis just means infection or inflammation of the oviduct itself. You've got malformed ova, abnormal ova, and then again, maybe even something as rare as an abnormal reproductive anatomy. Something's wrong with the reproductive system. Very sick-looking uro here and chameleon as well. And then nutrition is a big one, which we've talked a lot about that over the last couple of days. We certainly know, now you guys know, nutritional secondary hyperparathyroidism. We don't call it metabolic bone disease, but anyway, this, from improperly feeding these guys, this female isn't going to be able to lay her eggs because her little back legs don't function properly, so she can't, dig a nest to lay her eggs. And look at her spine. I mean, look how abnormal the shape is. This is like a roller coaster coming down here on this side. You see how straight up and down it is. So this is all in relation to not getting enough calcium and vitamin D3 and having nutritional issues. Here's a female here that actually, again, you can see, I mean, this is just dramatic, the amount of change in the spine. And this causes, the spinal cord is within the vertebrae and the bone structure. So you can imagine the spinal cord trying to, function with this abnormal shape. So they get weakness and paresis, loss of function to the rear legs, etc. This female was probably in a state of just barely had enough calcium in her body that she decided she was going to become follicular. And of course, that demands a huge amount of calcium on the body. So as soon as she did that, her rubber mouth, or that soft maxillary and mandibular structures we talked about yesterday, just literally peeled away, and her little tongue was hanging out. She couldn't even hold her mouth open. She just went into a complete state of disarray. And then, we know too that Dr. Ferguson did some fabulous work with pardalid, with panther chameleons, and found that vitamin A plays a role in a lot of things, but also reproductive disease. So dystocia could be a part of not getting enough vitamin A in the diet as well, specifically for chameleons, but probably for a lot of our other herp species as well. So how do we, as veterinarians, we call this a clinical assessment. Well, one of the most important things that we as vets have to understand, but you guys need to as well, is that there's basically two types of dystocias or reproductive related issues with our females. One is where you have what we call follicular stasis, and that means that there's a development of follicles, folliculogenesis on the ovary, but these follicles have gotten to an ovulation size, but then they're not being released, okay? They're not being released or ovulated into the oviduct, and or they're not being resorbed, because when they're in this state, like in this green iguana that we're getting ready to do surgery to remove this ovary, these guys, you see all the vascular supply here, so the body can flip a switch and actually suck that yolk back into the body and shrink these follicles back down. Okay, there's a choice. So let's say this green iguana, her prince didn't come, and so she didn't get bred, and so therefore she could either resorb these or ovulate and produce infertile eggs, but a lot of our iguanas, for instance, don't do that. But instead they became static, and they just sat there, and instead of going one direction or the other, they basically start to fall apart. So one of the things that's important about, fertilize, what happens is that once an animal ovulates, it's too late, okay? In other words, they have to already be fertilized before ovulation occurs, all right? So that's one of the main things to understand. A lot of people don't get that. Snake breeders, which we're going to talk a little. Well, I'll probably get to most of these questions as we go along, so maybe I'll keep going. But what I'll show you is how we can start to figure out what kind of condition those are in. I can show you that in a minute. So he's asking me a question about, so if they, as we know, lots of reptiles do retain sperm, especially chelonians, notorious for it, over a period of time, months to years. So if a female was bred by a male maybe a year ago, and it's a chelonia or a species that we know, then if that sperm's in the system, it's hiding in those little areas, then, well, actually, so for instance, in anolis lizards, I was involved in a paper when I was a young undergrad, and what we found was when we looked at the oviducts, there's these actually little crypts. There's tiny little, almost like hiding places, if you will. And in Anolis limifrons, we found these teeny little areas where that sperm can hide. So within the oviduct structure. So there's places for that. So the idea there is the sperm already being there would probably be the reason that she would go ahead and ovulate. She's getting some kind of feedback maybe from having the sperm inside her oviduct. But I think a lot of these guys, if the timing isn't right or the male isn't doing what we needed to do, because again, a lot of the stuff I'm showing you guys are pet animals. One of the things we deal with a lot as veterinarians is females being reproductive without a male, But you guys are all here because you want to reproduce these animals, right? And so it's very different for what you're asking me. And so I don't know exactly what things go on in these females where they end up having an issue like this when you've gone through the right steps to get them fertilized. I do think I think that the courtship scenario has been like for instance in short-tailed pythons, Dale Donato showed that when there was courtship going on and he introduced males earlier on in the game, there was a much higher chance that those females would go on and ovulate. So there does appear to be a male, but in other species that doesn't necessarily have to happen. But for instance, in that particular species of python, he found that there was a higher ovulation response when there was a courtship behavior by the male. So anyway, tough question. I'll work on that one for next year, I guess. I don't know. Anyway, okay. Anyway, so back to where we were. So follicular, that's one issue, and then the other one would actually be after these have been released, now they're in the oviduct. Once they're in this oviduct, then they have to come out, okay? They can no longer be resorbed at this point. So they're either going to come out this time, or people always tell me, oh, I had one lay and then came out next year with the next batch. Well, maybe that can happen in some situations, but the bottom line is when they're here, we need some kind of an action to occur in order to keep that female from having a problem, all right? Because these cannot resorb. The resorption only happens at the level of the ovary. It cannot happen once ovulation has occurred and these eggs are, these are uromastics, and these eggs, we're removing them surgically because they're not going anywhere, okay? So that's something that's really important to determine, because the treatments for those two are quite different. So here's, you know, unfortunately, chameleon on the half shell, which is quite routine, as all those that work with old world chameleons. We know these guys a lot of times don't like to live as long as we'd like them to, so we do a lot of necropsies on them. So here's a classic example. We have one that died here that's follicular. So she has follicular stasis. These ovaries got huge and then never did anything. Look how fatty looking her liver is as well. And then they became sort of rotten and just started falling apart, and she died of sepsis. And then here's one that ovulated. The eggs got into the oviduct, but then were never laid and passed, and she ended up dying from something else. I can't remember why. So how do we figure out if they're follicular or they're oviducal? You guys with me on that? So follicular, oviducal, very important thing. So we use these same modalities that I was telling you about to try to figure that out. So let's see if we can do that. All right, so which one's follicular and which one's oviducal from looking at this picture? Can you tell? I helped you with the little arrows, I think, maybe, right? So, all right, so this one's oviducal. You have, you know, within the oviduct, that's where the shell glands live, and that's where mineral is placed, all right? So we've got oviducal eggs, and sometimes in lizards it can be very hard. These things look big, but these are these big follicles, and you can see why most lizards don't eat when they have either follicular activity or oviducal eggs. There's no room for food in the animal. So green iguanas and a lot of the iguanidae group, and many other lizards, they just won't eat during this time, and that's very normal. So these are the kinds of things that we can look for with radiography, all right? How about these two? What do you think? Which one's got true eggs and which one has follicles? Yeah, this guy, right? I mean, these are pretty dense. They're probably abnormal, they're so dense. I don't know, those are pretty funky looking. But you see how round these guys, the more round they are, the more likely they're follicular. Well, in old world chameleons, you know, either way, these guys are in trouble. It's a very common problem with them. A lot of our females get follicular like this and then don't do what they need to do. And then chelonia are kind of wonderful for this because the x-rays are usually quite helpful. And what I've got here is, believe it or not, you might look at those and think they all look okay, but these ones with the end, those are actually normal, okay? And then do you see how there's more shell on these? Those are actually abnormal. Those have been retained for longer. There's an abnormality with those. Those have too much mineral on them. And then here's a dramatic, look, we can obviously see, once you start to see different shapes, and then this one's really round, that one's flattened, this is going to be a surgical case, okay? You're not going to be able to get these out any other way probably. And then, anybody have an idea what happened with this animal over here? You see these eggs here, and they don't look great, they look thickened, right? What about this guy? Ruptured, or, so it's one of two things. It's either in the bladder, okay, and what happens is they go to lay the egg, it gets sucked back up. You just saw how big the bladder looks. I showed you we were in the cloaca of that turtle just a few minutes ago. You guys were up in there looking around. Well, you can see how that egg just gets sucked right up into the bladder. And then when it gets in the bladder, this laminated effect usually occurs. You've got urates that get laid down like a tree, you know, like rings in a tree. And so when you see that again, that's a surgical case because we're not going to be able to get those out any other way. So anyway, so good stuff there. And then again, ultrasound. So there's two leopard. Believe it or not, we spay in a lot of leopard geckos. I know you guys would be blown away by that, but people love their leopard geckos, and you know, $550 to spay your leopard gecko, and people do it. They love their baby because you know it's Lizzie. It's not just any leopard gecko. It's Lizzie the leopard gecko, right? Okay. Anyway, so here's the follicular. Here's our follicular. So this one, she had these follicles in there and they weren't going anywhere, and she was not eating and not doing well, and they're like, what can we do? And I'm like, best thing to do is just get in there and remove her ovaries, and then she's good to go forever. We don't have to worry about her doing this every year, off eating. And so we go in, here's her little incision, we take these ovaries out. You see one of them had two funky looking follicles on it. And that's what it looks like on ultrasound. The follicles are very, what we call homogeneous, very round and consistent. And then this kid down here had a whole lot more going on. This one actually had an egg, a rotten egg in it that had been there a long time. That's the egg. How healthy does that oviduct look? Not very, very inflamed and unhappy. And then these are the two little ovaries that we took out. And so on ultrasound, we can see that little shelled ova right there. And then the little black circle there is one of the ovarian follicles, and that's the spine. Okay, so you guys are getting you're ready to go, right? You can identify these things. And then this is, I believe this is a Chelonian torus, where you've got these are early follicles, just the little black circles, not much going on. Here there's vitellogenesis going on. These are at pre-ovulatory, the big round yellow things that we keep seeing. And here it's been ovulated, there's actually an egg. And you can obviously see on ultrasound how definitive that shell looks. So maybe this is the Chelonian one. That might have been a lizard, actually. That could have been an iguana, and then maybe a water dragon was the egg. But anyway, same kind of thing. With follicular, very consistent round circles, and then with our Chelonians, because they have a lot of calcification and mineralization of the eggs and the snapping turtle, we can see that quite dramatically, all right? And then what about snakes? Well, snakes, to look at the anatomy, we have, obviously they're linear. We're doing one of our little ultrasound baths here. Here's your anatomy that you're looking at. This is cranial, this is caudal, that's the kidney we've talked about. And then here's the oviduct going down like that, and then here's that long ovary, all right? Here's one, a necropsy. This is gallbladder staining because it had been dead for a little. This is what happens if Alan waits like 3 days before he sends me the dead animal, and it's decomposed, and so all the green. But anyway, so these are follicles that are these are fairly healthy looking ones that are maturing in a variety of different levels. Here's one where they've developed and then they're looking very unhappy now. And then this is what you might see on ultrasound. And actually a lot of the snake people in the audience, many snake breeders are utilizing ultrasound. And with an ultrasound, you can actually start measuring these follicles and the size, and then you can know when to put your male. So for ball pythons, for instance, if you ultrasound your female ball python, you're trying to figure out whether to put a male with her. If you measure your follicles here and they're between 15 and 25 millimeters, then you need to get a male in there to start working on that female. Once these are measuring over 30 millimeters, then it's too late. And they're probably already ovulated, and so now you need to take that male and put him with other females, so you're not wasting energy. So it's a very effective way of getting the most out of your males, is using the ultrasound technology to figure out where you should be putting your males. And you could probably do that with other reptiles as well. Snake people have been on top of that. So what happens, kind of getting back to what Alan was saying, well, how do we know when these are really bad and not doing well? All right, well, this is a Savannah monitor that died, and this is sort of classically what begins to happen. When these are the pretty ones that are healthy and generally doing well, and they're very homogeneous, right? When they start to break down and become unhappy and degenerate, if you will, they start to lose that nice consistent echogenesis, and we see darker areas and areas of irregularity, and that's what these guys look like. They're rotten and becoming liquefied, etc. Now, the only thing that makes that a little bit confusing is that when we're doing, remember we talked about how they can regress as well, and the body can take that yolk back in. Well, that can actually look somewhat similar to that as well. So during regression, it's sometimes hard to tell whether an animal is resorbing the follicles and actually going in the right direction, or whether it's becoming degenerate. And usually the animal will tell you if they're still bright and alert and doing well, and you're starting to see this, then maybe it's actually shrinking down and putting the follicles, absorbing the yolk material for next year, if you will, and they're going back down to a small size. But if it's looking like this, with this kind of change, then we know we're in trouble. And one of the interesting things is I have not seen a lot of follicular-related disease in snakes, but to be honest with you, it doesn't happen very often in boids. But in the Pantherophis, the corn snake specifically, I've seen lots of that over the last few years. So we have a lot of corn snakes, females, adults, they come in, there's sudden death, and on necropsy, this is what we'll find. And here's the ovaries that are all rotten and degenerate, and you can see secondary infection. And so I'm seeing that a lot more in the Cluba. Here's one that we actually spayed. Again, yes, people do love their corn snakes, and they had me spay this animal. One of the things that's challenging about spaying a snake is, do you see how long these ovaries are? So we taped off the area of concern. So I knew the ovaries were about from here to here. Because remember, from our diagram on anatomy, they're staggered. Okay, the right one is slightly ahead of the left one. So basically, I end up making either one long incision to get both of these out, or sometimes we'll make two. I think my incision is right there. No, maybe it's there, and it goes to about right there. So sometimes we can stretch things out, but it is and this is why, well, why does it cost so much for me to spay my snake? It's so much more than a dog or cat. Well, it takes me a lot longer, and it's a much more delicate procedure. So I'm very sorry about that, but yes, it's quite complicated. You can see how unhappy this tissue is here. So that pretty much saved her life, and she's doing great. All right, so back to how do we manage these guys? Follicular stasis, well, we try to, remember the things we talked about, we're trying to figure out, is this Is the animal going to resorb, or is the animal going to have a problem? And sometimes we can tell by the way the animal's acting. Or if we're breeders like guys like you guys are, we may want to pair, hey, there's follicular activity, let's pair that animal up. So maybe we need to get the male Abronia with the female and get busy with the courtship over here. If it's a pet animal, a lot of times my clients just want to spay him. So here's a crested gecko that's having its ovaries removed because they just want you to fix it, all right? They don't want to worry about having follicular activity every year. So we do a lot of these. And then this guy obviously looks, you know, not a good looking gargoyle gecko. Something's going on in there, very busy looking, all right? So these are the things that we can try. Are they doing, which one of these are they potentially doing? And then remember, here's something that's very important. Oxytocin is not indicated for these follicular cases. Why would that be? Right, because the reproductive products that we're talking about, they're not even in the oviduct yet, okay? They're attached to the ovary. So there's no reason to make those oviducts contract and try to push something out because they're empty. So this is very important, and this is one of the things that's discouraging to me because I find that a lot of people are not familiar enough with what's going on, so they're giving oxytocin to follicular animals, which is malpractice in my mind. It's not appropriate, you know. So I've even seen that on one or two of the vet TV shows. Imagine that. I can't imagine why that would happen. But anyway, so the point is be knowledgeable about that. So here's standard follicular surgery in a green iguana. We go through and we ligate these vessels, and then if we don't do that and things don't go well, this is the kind of stuff we can end up with. We call it egg yolk coelomitis. Well, basically those follicles rupture open and discharge all their yolk and material, and that yolky material creates a great deal of inflammation in the animal, and so they end up dying of peritonitis, or we call it coelom. Remember that reptiles have a coelom, not a peritoneum, because their heart and lungs are in the same cavity as their intestinal tract and their gonads and stuff. So they get a coelomitis and die, or oftentimes the follicular activity just goes crazy, and we've seen this in some of our older rackies or whatever, this kind of follicular change. Things just go aberrant, and because normally these guys produce 2 eggs at a time, so only like 1 follicle on each ovary should be there, but you can see this older female produced tons of follicles and ended up dying. And then here's another case, is an auriculatus that we went in and so we did an ultrasound of it, and we're seeing these 2 big ovarian follicles that look quite crazy, and we measured them, they're much larger than normal, and we went in surgery, and these are what hurt. What do you think about those ovaries? How do they look? Terrible, right? So we removed those, and she came through with flying colors, and unfortunately she's not producing babies, but she's out there as somebody's pet. And then chelonians, how do we treat follicular disease in chelonia? Well, the cool thing is we've started doing a lot of things with our turtles and tortoises through what we call the prefemoral area. And that's the area, here's the rear limb is pulled back in this direction. And so this is that space where we palpate. I showed you where my fingers were palpating the box turtle. We make an incision here, and then we use, this is basically a contraption that we use to actually stretch the tissues. It's a retractor is what it's called, Lone Star retractor, and it helps to pull these tissues and open them up. Then we go into that little opening with an endoscope. We find one of these follicles, we grab a hold of it, and we gently tease it out of the incision, little by little, until eventually we've completely removed all of that over, and we ligate all the vessels as we gently remove it. And then we suture that up, and off they go. And that incision is going to heal within 4 to 6 weeks, as compared to me cutting through the plastron and taking a year to heal, and the amount of pain that's associated with cutting through bone and removing bone. So these are some of the procedures that we've been able to develop. Here it is again. This is in a slider showing the ovary kind of, it seems like when you first start, it's like, I'm never going to be able to get this ovary out of here, but you just have to have patience and gently work this guy out. And then sometimes, no matter what, we have to go through the plastron. So here's a big tortoise where we ended up having to remove the portion of the plastron, and then we're using radiosurgery here to ligate the vessels in this. So this is a very follicular, remember, not oviducal, but follicular stasis tortoise that we ended up doing surgery on. So what about the true dystocia? Now we're talking about, we've released those follicles, they're in the oviduct now, okay? And now maybe we have a problem. We know now that those eggs, we either have to go in and get them, or we have to figure out a way to get this reptile to lay them on her own, okay? We can't just let them sit in there. They're not going to resorb, right? So here's the things that we can look at. We can supplement if we're worried about, like, maybe they're not that far along, and if we can supplement and do a better job. This is one of the things that's important, was if they've already laid some eggs, how long ago did they? Because that's important for the management, and we'll talk about here in a minute. Have we provided a proper nest box? One of the things that Andrew shared with us yesterday about the Chihuahua is when he has females that he thinks have not laid when they should, he isolates them, puts them in a small box, increased humidity with a substrate, and he can get the females to lay. So that's fantastic information that I can put to work right away. So maybe it's just that we're not providing these females what they want to do to get rid of whatever it is they're holding on to. And then again, if they're pets, even if they're oviducal, we can still go in and remove those reproductive parts, and then the owner doesn't have to deal with it again like we did with this little leopard gecko that I showed you before. So here's the big one, oxytocin. So all right, well, why can't we just use drugs to get them to lay? All right, well, there's a bunch of issues associated with that, and it's one of the things that I get quite worked up about, because I think that oxytocin is used incorrectly often. Let's just put it that way. So remember, it's not an innocuous drug. You are asking those oviducts to contract around that egg or that fetus, okay? And if there's a reason that that shouldn't take place, then you potentially could be causing a great deal of harm to that animal. So what do we need to do? Well, we need to make sure that we have an appropriate situation before we start using something like oxytocin. So either they've laid maybe part of a clutch or given birth to some baby, so we know that they're ready, that they're primed, and that the hormones are saying, hey, this is the time to produce. So a good time to use oxytocin, knowing that things are ready. We have to make sure that, again, we've tried all the other things that would normally work. We have to make sure we've got them hydrated. One of the main reasons that sometimes they don't want to lay is they're dehydrated. You saw how thin-walled that oviduct is, so you can imagine if that reptile is dehydrated, that thin wall is like tissue paper. It sticks to that egg that's in there, and then that egg does not want to slide and move out of the oviduct like it's supposed to. So these are the things that we want to do. And then prior to use, we have to rule out an obstruction. Would you want to make the oviduct contract and try to push something out if there's something obstructing it, like a bladder stone? Would that be a smart thing to do? Or remember that big monster egg that we saw that had you would not want to give that tortoise oxytocin, because it's going to rupture the oviduct or create more damage. And again, that's not appropriate. So we need to so oftentimes x-rays might be indicated, all right? Or probably are in most cases. I do realize that not everybody has access to radiographs, but this is when you consult with your veterinarian about what makes sense. So anyway, you need to correct the hypocalcemia. Again, a lot of times maybe they're not laying the eggs because the animal is exhausted from a calcium standpoint. That's more of a chelonian and a lizard thing and not a snake thing, as our snakes eat whole vertebrates, and typically calcium deficiencies are not something we see in snakes, very rare, so I don't worry about it as much in snakes, but certainly in lizards and chelonians. And again, the great news here is that chelonia, with their natural history, if you look at, there's a lot of chelonian species that can retain eggs for extended periods of time, and that's normal for them, because they will wait for the right time to nest, as we all know. And some of the great work that's come out of the Savannah River Ecology Center down there, they've shown that some of these aquatic turtles, et cetera, can hang on to eggs for 4 to 6 months before they lay and still have a successful laying. So I think because of the fact that chelonians can normally hang on to, we have a lot more leeway with getting oxytocin to work. So this is the dose that I use, a much lower dose in turtles and tortoises. One of the tricks that I do is, instead of giving it as an intramuscular injection, I give it into a bolus of fluid, and then the oxytocin is absorbed more slowly, so it's slowly causing contraction of the oviduct rather than one big bang, and then the oviduct contracts. So it's a theory thing, but it's something that we've been doing, and I've had better success by putting the oxytocin into a bolus of fluid subcutaneously in the chelonian. And then here's our big problem: as lizards and snakes, you have about a 48 to 72 hour window when we find it's effective. If you've gone 2 or 3 days or 4, it's probably too late for oxytocin to work. And the reason that happens is that that egg in that thin oviduct there's a fibrin adhesion that occurs in the oviduct. So when that egg sits in there longer than it's supposed to, then the oviduct sticks to the egg, and now that egg is attached to the oviduct. So if we give oxytocin, again, we're going to create trouble, because that egg cannot be released, it will not slide, and now we've caused some kind of a binding or a tear or a prolapse or something along this line. So it's a difficult situation, and this is where my breeders that I work with I oftentimes they will have oxytocin on hand, and I will prescribe it to them. They will have it so that if it's on a Sunday and they can't get a hold of me and they need oxytocin, I don't make them drive 3 hours away or have to ship it to them. So my good clients that if I'm working with them regularly, I will make sure they have oxytocin, and then they may call me and say, hey, should I use it or should I not? What do you think? And of course, I might want to have an x-ray, but maybe if it's an animal that economically they can't afford to do an x-ray, then you may take a chance and use the Pitocin or the oxytocin anyway. Okay? But the idea is that we need to understand how it works. So this is how we do it here. Unfortunately, arginine vasotocin is the reptilian equivalent of oxytocin, but it's not available to us, so we don't have that. So, all right, I'm moving along real quick now. Here we go. Medical management. One other thing quickly is that it does appear that viviparous snakes may have a broader window for that. There was a case where an animal gave birth to some babies. A week later, it came back in. They gave it oxytocin, and it actually gave birth to a few more healthy live babies. So it may be we've got a bigger window. I don't know about our viviparous lizards. That's something we need to learn about. And this is the kind of thing that can happen when you give oxytocin to, this is a reticulated python that came in. It got like 5 doses of oxytocin at a referring veterinarian's office, and then I was like, okay, let's go to surgery. And this is an oviduct with an egg in it, and you can see that it's twisted around and around and around on itself. And it's completely, the blood supply has been completely destroyed. Here's how, after I unwound it, what it looked like, okay? And this is where, again, the oxytocin was used inappropriately. And then here's me cutting in the egg is just completely adhered to that. And that's what the oviduct looked like afterwards. Unfortunately, we ended up having to remove that oviduct and the ovary on that same side in order to have that animal be reproductive. I got to keep moving. I got to hurry. And then here's another case where oxytocin was given over and over again. And what ended up happening is this fetus that was in this boa, there was only one, but it was abnormal and it was dead, and it actually ended up being ectopic. So here it is on an x-ray sitting outside the oviduct, and this is after we went in surgically and removed it. It was a dead fetus. And then unfortunately IBD, or rhabdarrhinovirus, is another cause of dystocia in boa constrictors. This is a female that went almost to term. Remember what I showed you before, how nicely coiled those baby boas were? Look at this one. This one actually had, these boas were completely linear on the radiograph. You see how abnormal that is? They're out of their coil. They're trying to get out of the animal. And then, unfortunately, after we took these radiographs, she died. And this is all the dead babies inside. So remember, there can be viral diseases and other diseases that can cause that. But to give you some hope, you know, occasionally there's a good case where we work it all out. This was one of my really good basin breeders, and he's very concerned about his female. He did everything right, brought her in. We checked on ultrasound. There were live fetuses with heartbeats. He had great records, so we knew that she was actually 2 weeks overdue. We gave her the oxytocin. 1 hour later, 9 babies popped out, and so we at least saved that number. So it can definitely work. How about oxytocin for these guys? What do you think? No. Definitely not. We already talked about why. Look how thick these eggs are. It's crazy. So that's not a good idea. So if we have eggs that look like that, then we have to get back to standard surgery for a lot of these chelonians. And we may, for getting eggs out like that, we're going to have to do the plastinotomy. And here we are removing this cutting into the oviduct, removing these eggs, and this is a female recovering. So and here we are removing the oviduct in this particular animal. For lizards, again, there may be situations where we've missed our window for oxytocin, and the only way to safely get those eggs out is to do conventional surgery. And I think this was a Gila monster or maybe a beaded lizard, and we're gonna remove this egg and keep the oviducts in there because we want this animal to be reproductive in the future. This green iguana, we don't want to be reproductive in the future. We'll just take the oviducts out with all the eggs in it, okay? And then maybe, again, a species of chameleon where we want to remove the eggs but leave the oviducts inside. Or maybe, look how bad, this is a panther chameleon that had obviously a severe dystocia. Look at the eggs, this is the oviduct. There's like 40 of them all piled in there together. Is oxytocin going to work very well on that animal? No, probably not. And then egg manipulations of snakes, they're a little bit different. We have more options with snakes, so I'll very quickly go through this. So for snakes, we can have the ability sometimes, let's say the oxytocin, we've missed the window, we've taken some radiographs, and we don't see anything obvious going on. We can sometimes sedate these guys, and we can manipulate eggs and sometimes make progress. We can't usually do that with lizards, so let me just quickly show you these clinical cases. So here's a situation where the most important thing with these is clients will try to manipulate the egg out of a snake with it awake. And you already showed you what the oviduct looked like. Can you imagine why so many of those tear and don't do well? In fact, I see it on the internet. People are jabbing things up inside the cloaca of a snake and ripping an egg out or whatever and telling people that's acceptable. That's not acceptable, okay? Please, we've got to get past that kind of stuff. These animals deserve better than that. So what we do is once the animal's relaxed, if that egg will slide down, if the animal's kind of like when we were doing the hemipenal thing, trying to pop it out, if that egg will, after the animal's asleep and under anesthesia, if I can gently work that egg down towards the cloaca like I was able to do here in this Honduran milk, then I can sometimes aspirate the fluid out of it, collapse it, and then gently remove it. And we don't have to do surgery. We can get that egg out. And if there's another behind it and that one slides down and moves, then we can manipulate those out. This is the kind of thing that happens if you try to do that at home while the animal's awake. So here's the oviduct of a green tree python that prolapsed when the owner tried to push an egg out. And once that happens, then that oviduct is no longer effective. One other thing we can do with snakes, again, that doesn't work as well in chelonians and in the lizards, is cloacoscopy. Remember we talked about going in. In some of these cases, this is what the cloaca looks like. This is the uridium with the two openings of the oviduct. This is the opening into the colon, and that's inside one of the oviducts where I'm using the fluid to expand. I've gone inside this oviduct and I can see in there. So oftentimes if there's maybe 1 or 2 eggs, we may be able to retrieve them with the endoscope this way. And this is a hognose snake that had a retained ova, and there was some, obviously, infection going on there as well. A carpet python that came in that had a dystocia going on, and we tried the cloacoscopy. Oxytocin wasn't recommended because they had waited too long. And so this is what I saw on endoscopy. Look how inflamed the oviduct wall is and a very abnormal looking egg. So we attempted to remove it, but it would not come out. So what we ended up doing is we treated that animal for 2 weeks with antibiotics and anti-inflammatories. We went back in 2 weeks later, and you can see how much healthier the oviduct looks, and the egg was starting to break down, and we were able to grasp that. And then and these are the egg components that we were able to remove with the endoscope. So sometimes endoscopically we can remove these ova if there's a few number and not many. And then one of the last ones is this percutaneous aspiration. This is where we're collapsing an egg. Maybe that egg won't move to the cloaca. That's the only option that we have, is maybe the owner doesn't want to spend the money to do conventional surgery, so we may have to do this. We use a 18 to 20 gauge needle, and we scrub and prep this like we'd be doing surgery. We go into that. We aspirate the contents of the egg, and then oftentimes this hognose snake passed out one of these collapsed eggs. The problem is this has, you can get associated coelomitis with that. You can get inflammation, or some of the yolk material leaks into the animal's coelom. But if you have a situation where cost is a concern and we can't do conventional surgery, then this may be an option for us to give this animal a chance. Okay, so that's called egg yolk aspiration. Now, there's some cases if it's a ball python that has had eggs retained for like 8 months, the aspiration technique isn't going to work very well, because you see what the eggs look like? They're solid, right? There's no fluid in here for us to aspirate, so this is where conventional surgery is going to be necessary. And indications for surgery, so we've tried everything else. Maybe we have a prolapse going on, or there's an obstruction, and we do some crazy, this is my early days, we took 2 tables to get this big berm on here, and that probably took like 3 hours to do that surgery. Or maybe this case where this is a very valuable animal, 3 eggs were retained over a period of time. We did surgery. One of the tricks that we do is we'll make a very small, this animal is very important to be able to reproduce in the future. Sometimes surgery is the best way to safely get these eggs out. We make a small incision, we infuse saline in here, and we end up lubricating all 3 of these eggs with the warm saline, and I can get them all out of one incision. And that tiny little delicate incision, this animal is able to breed for us in the future. And then I think this is the last one, I promise, Alan. So here's one that was presented. It's not the same animal, but it was a green tree python that had prolapsed, and this is the oviduct. And the owner, actually said to me, "Is there any way that I can put the oviduct back in and reattach it?" And I said, "Wow, I'm good, but I'm not going to be quite that good. I don't think we're." But everything on TV gets better and worse, right? So I kind of had to inform him that no, that oviduct is not something we're going to be able to, because it's completely shriveled up. So what we were able to do, though, and this is what that looked like. Okay, so we went in, we found the other, and so that oviduct you saw that was outside, this is what was left on the inside of the animal. So we go in surgically, we find this horribly torsed egg. Again, this is an animal that had oxytocin that probably shouldn't have. And so looking at this, I can't repair that, and the oviduct is out. So what we ended up doing is we removed this oviduct, and we remove the ovary just on that one side. Here's the little ovary here. Here's all the other eggs that were retained. Here's the very abnormal ovary, and there's the ovary that I went through and ligated. So we were able to do what we call a unilateral ovarectomy, and we've done that on many snakes that have value. And most of those snakes go on and will lay eggs the very next year out of only just the one oviduct. Okay? So I'm way over time. I'm sorry about that, but thank you so much, everybody, for your attention. I appreciate it.
Again, thank you, Scott. Really still one of my favorite speakers at Herpeton. Next week, we've got more Herpeton for you with John, and he's going to be talking about keeping miniature western desert species in captivity, and snakes in particular. And John is just like a legend of herping, so you don't want to miss out next week. Until then, you've been watching Triple B TV. Y'all take care.